Good day everyone! Andito na naman ako sa aking favorite place, of course, none other than CSA Medical Aesthetics. And I'm Miss Weng Aguilar Laughlin, your Mutianang Pilipinas Provincial Director here in Pampanga. About 4 months ago, I underwent non-surgical nose enhancement and also facelift and lip fillers. And marami pong naka-notice sa akin. Many people are telling me that I look 10 years younger. And you know what the secret is? Here it is. Yun pong procedure na ginawa sa akin dito sa CSA Medical Aesthetics. And for today, I think Dr. Contessa will do another procedure, yung under eye treatment and foxy eyes. So to achieve my well-balanced and the right proportion of my face. So, dito lang po mangyayari yan sa CSA Medical Aesthetics. And don't forget to click the subscribe button and notification bells for more updates.
Good day everyone, welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome Ma'am Weng Laughlin.
Yes, hello, hi!
So in the past, we did a procedure, the so-called forehead projection, nose projection, some nasolabial filler with threads, and the lip enhancement. How are you, Ma'am Weng?
I'm okay, Doc. Yeah. You know, ito, bumabata lalo.
That is our goal here in aesthetics. And right now, we want you becoming younger in a natural way, plus beautiful in your age. Okay?
My age.
Correct.
Yes.
So, it's something that people, when they see you, you're looking younger and you're looking refreshed.
Yes, it's very uplifting, Doc. Kasi,
exactly.
Yeah, many people notice that I look, 10 years younger daw. So, lahat nagtatanong ano yung secret ko. And ayan, na-watch na naman po nila yung mga video ko.
Actually,
yung mga procedure na ginawa.
I'm really looking at her face. I'm really amazed at that transformation. Yes. So for now, we will complete the treatment, the so-called like full face rejuvenation, by treating the periphery of the face or the outer portion of the face. So if you've noticed, we focus on the center of attraction. So right now, we'll work on the outer part of the face. Yan naman, Ma'am Weng. Okay?
Oh, I'm so excited.
Right. So, for the outer portion, okay, so if you remember last time we did like forehead projection, you had combined filler and threads on that one to restore that, what we call the convexity of our forehead. So, dapat smooth and convex ang forehead. And with my assessment, I can still see a little bit more of the dent in the glabella area. So, we will still correct that. And then, on the sides of the eyes, yan. This one we didn't actually touch, right?
Yes.
So, we still notice this one, the corner of the eye, the upper eyelid, and the tail of the brow. So, right now, we want to, lift that up. Or,
eyes.
Yes, we call it the fox eye thread lift, okay? So, we want to pull this upwards here to open up the eyes of Ma'am Weng. Yan. And to complete also the periorbital rejuvenation, we will also improve the skin under the eye area. If you notice, we have fine lines there. We also have the tear trough there. And some skin laxity. Okay, if you pinch and release, yun, positive. So, pinching, you have that pinched skin and you release it, you'll still notice there's already like a slow return to the flat position. So, meron ng Ma'am Weng, loose skin under the eye. So, we want to improve that.
At my age, syempre, na po yun, expected.
How young are you ba? Ilan taon ka na ba?
57.
Ayun, sinabi ni Ma'am Weng.
57. I'm
So,
happy about my
young
age,
looking,
yes.
and then, so we will improve the quality of the skin under the eye, and at the same time, we want to still improve this malar sagginess here. I'm still noticing this cheek groove here, and some ptosis or sagginess. Yeah, that's the like common term, or what we call layman's term for ptosis. Yung merong nagbagsak, nag-descend. So the descent here, we wanna also lift this up, okay? And when you say the periphery, the outer portion, you still wanna also improve a bit on the subzygoma here and a little bit on the angle here of the jaw. Yan. Parang contour pa rin. But we'll focus right now, okay? So, ayan, with Ma'am Weng, we're doing treatments na yan. It's like in different sessions. But every session, you see a result. Amazing result.
And all non-surgical.
Correct.
No, that's another thing.
That's our, like, what we wanna have been done for us, non-surgical. Kahit ako, Ma'am Weng, I'm into non-surgical. That's my advocacy. And just wanted natural results. And hindi yung you look, you know, artificial or
very
you
natural po, Doc. That's one good thing. Na pag nakita ka ng tao, something has changed, pero parang very subtle po ang pagka-change.
Actually, Ma'am Weng, hindi subtle yung nakikita ko sa iyo eh. It's like, yeah, yun nga, somebody like mentioned na you're like a flower blooming.
Yes.
Yun yung nakikita ko sa iyo. So, yun, not looking artificial, not looking na yung retokada, or like,
very natural po.
Hindi na gumagalaw yung mukha, yun. Pero with your case, you still have that good facial expression. And the muscles, the tissues, still have that good gliding. So, maganda pa rin yung expression ng face, making you look younger, refreshed, and more natural. Ayan! Yes. We're excited with the procedure. We'll show it to you when CSA Medical Aesthetics returns. And we're back. So, we're doing again a continuation of the full face rejuvenation for Ma'am Weng. Okay, so the first one that I will be doing is the so-called fox eye thread lift. Okay, a while ago I did the so-called nerve block. So I did the supraorbital, infraorbital, and mentalis nerve block. Okay, and then I'll still do the local infiltration of my lidocaine here. I'm using a tumescent solution here. So for my entry point here, this is the so-called fox eye thread lift. It's a reverse method, not the classical one. Okay, I'll start with one here, and then I'll make a puncture of the entry point. Then I'm using a double cog here, so glide this here into this layer. Well, you can go layer 2 with subcutaneous, or you can even use the interfacial layer here, or the layer 4, and then just direct it upwards toward the hairline, then pull it out, and then I'll use a second one here, so like a 1 cm interval. Okay, so I'm at the tail of the eyebrow here, and then just direct your lidocaine into this line here. So it's like a diagonal vector here, and then make your entry point. So I'll prick here. So this is the so-called reverse method here. So bevel down here, and then just glide, go on towards the hairline there, up to the scalp region. Okay, so it's normal that you feel, Ma'am Weng, kind of like your hair is being pulled upward. And then as 1 cm interval again, it's like you're near the arch of the brow here to give that good arched eyebrow. Okay, we want to lift the eyebrow at the same time the upper eyelid. Okay, so for those loose skin in the upper eyelid, you can actually combine it with some of your monofilament threads. You can use either there's an inch thread, there's also like a screw thread. You can use those. Okay, just glide it in the area, and then you can pull it out, and then just pull the exposed strands here, and you can cut. Okay, there's also a technique right now. They kind of do a reinsertion technique. You can also do that. There's a method of reinsertion whereby these strands, you don't need to cut, you just reinsert. Okay, so this is the reverse method without the reinsertion technique. Okay, now I'll also want to do the under eye area. Okay, so under eye, new OS please. Okay, we're just gonna do pressure here. It's normal that you have some bleed there. I'll be using the PDO under eye thread or derma threads. Okay, I'll make an entry point here just as tiny bulge of your lidocaine here, like you're creating a papule there. Okay. So for this one, I'll be doing the kind of step ladder pattern here. Like I'll make initial 2 entry points here. So I have a short one here. Okay, so this is a gauge 30 needle, and it has just a short, like a 25mm length of my needle there. There's also one that you can use, which is the longer one. There is a 40mm of this one or a 50mm of this one. You can use those too. Okay. Then I can again do another puncture. You can also use a single entry point only and do like a fan method. For now, I'm doing like separate entry points just to strengthen the pieces under the eye area. Okay, so I'm making 5 punctures and 5 pieces of this. So just glide it in the subdermis. Since this is a monofilament type of thread, you can place it in the so-called, like either your layer 2 or even your deep dermis. Okay, so Ma'am Weng is a bleeder right now. Then I'll combine it with my reverse method of lifting the malar ptosis here. So we can do an entry point like in your mid-cheek groove area here, or where your zygomatic cutaneous ligament is. Like I can make like 2 here, and I'll be using a cog thread here and make it in a diagonal vector. Okay, just using again my tumescent here. Okay, you're still good, Ma'am Weng?
Yes.
Okay. So I have the so-called Cobra Cog 90mm. Okay, and my entry point will be at the so-called part of the zygomatic cutaneous ligament here. So making the line there. So I want to pull the so-called malar ptosis here. For my patients who have the so-called malar ptosis, this is also a technique that I do. Okay, I'll just use my, again, a reverse technique, not the so-called classical technique here. Okay. Give me new OS here again. Okay, just glide. So you can go initially subcu layer and then go towards the interfascia layer, or between those superficial temporal fascia and deep temporal fascia there. Okay. So lifting that, and I can use a second one. Then we were explaining about doing a lifting towards the periphery of the face or the outer portion of the face. So I'm already on my second cog here. So using my tumescent solution, okay, just do local infiltration of your track of the thread. This is the second one here. Okay, so OS. So Ma'am Weng is just a bleeder right now. Okay, so we're going subcu, and then I can go interfascia plane again here towards the hairline there, the temple hairline here. Okay, there you go. Then I can add after this at the like jawline area there, like your angle of the mandible. I'm just gonna cut here. Okay. So here, I just want to support this part of Ma'am Weng, the outer portion here. I can make my entry point here and another one here. So again, this is a reverse method. This is not the classical one that we do. So right now, we've been doing combination of the classic and also the reverse one to really give that strong lift, strong pull. For people who don't want to go through the knife or don't want to really do that surgical facelift, this is a good alternative for them. Okay, so make an entry point. So we're actually near the angle of the mandible here, and I'm using again my PDO Cobra Cog with 90mm length and using the reverse technique. Okay, so some doctors are doing also the reinsertion method, or like a flip method, whereby they reinsert the protruding thread and kind of create a so-called like anchoring of that one, so which you can also do. Okay, so I can use a second one here just to reinforce. Okay, so this is good for those individual who wants to do lifting and also wanna still have that V contour or smaller face, narrower face, especially Asians, because our face is rounded or wide. So we don't want to create a kind of more widened face. So for us, we want, like Ma'am Weng and I, we want to make our face slimmer. So this is near the angle of the mandible again, and just glide. You can go in the layer 2 here, the safe layer. You don't want to go deeper because you don't want to touch the layer where you have your facial nerves there, okay? So we're going up. We're near the zygomatic area already and to the temple area. So again, a reverse technique. There you go, and we'll pull it. So this is doing our cog lift for Ma'am Weng. So let's do the opposite side. We have completed our procedure for Ma'am Weng. We'll show the result when CSA Medical Aesthetics return. And we're back. Let's show the result to Ma'am Weng. Ma'am Weng, here's a mirror for you to check the outcome of what we have done. So this is the immediately after. So of course we have this swelling. I injected a lot of the lidocaine, especially on the temple region and also on the outer part of the face. So you'll still see some bulging from the lidocaine injection, okay? So this is more for reverse method of doing your facelifting on the periphery of the face. So basically we focus on the temple region and also the malar lifting using the reverse method, okay? So, Ma'am Weng, how are you?
Yes, parang hindi ka pa man nag-i-smile, naka-smile ka na.
Ka-smile na.
No?
Because you're doing like a repositioning of the saggy tissues towards the upper outer part of the face.
Nice,
there you go.
Doc.
Yeah.
Thank you.
So I also added a little bit on the nose, okay, because we've done already nose thread lift for Ma'am Weng. We did use the Wyco threads, and I just added a little bit more on the bridge dorsum just to, you know, increase the height and improve the projection of the nose. And I added on the midline part of the forehead 3 of my cog threads, PDO cog thread 60mm, just to improve further the projection, plus also treat that dented line on the glabellar area, the vertical static line on the glabellar region. And we noticed already a lifting of the corner, the eyebrow, okay, and the malar lift. Okay, we have swelling. We'll still like do follow-up for Ma'am Weng. Ma'am Weng, we have to do ice compress right now, okay, because you have this multiple injections, multiple insertions of our threads, and this is the reverse method. It's not the traditional or the classic one that we do. I'll also relax the frontalis here because we're noticing a strong frontalis. We will do some Botox injections for the muscle there just to relax this strong pull of your arch of the eyebrow. Okay, so far so good, Ma'am Weng. Okay.
Yes, another very good treatment.
Right. So we'll show the audience like yung mga pictures mo after 2 weeks. Okay, so what was the outcome? So during your recovery period, okay, we'll share some of the photos there. Like you can share with us 7 days after, 14 days after. And I'm also assessing this part of the face, the jawline area. Next time we'll work on this one. So the angle of the mandible and plus also this pre-jowl sulcus here. And we haven't touched the neck of Ma'am Weng, okay? So her neck actually is also good. So of course, in that age, we notice some laxity also there. So next project, Ma'am Weng. Okay.
Yes.
So non-surgical procedures, some natural enhancement, reversing the aging process. So this is not something that's super aggressive. We have done it like gradually, you know, we have some, you know, we started with some minimal enhancements for Ma'am Weng, right? So it's like how many years na ba, Ma'am Weng?
Yung from
mga
the
treatments
start,
natin.
in 2 years siguro from the start po tayo. Yeah.
So you can see the journey of Ma'am Weng, like in this age, okay, between 50 and 60, no? So that year, okay, she had done like a procedure, a treatment for herself, you know, to enhance, to reverse the aging, to become youthful in a natural way. Yan. Thank you, Ma'am Weng.
Thank you so much po. And of course, Doc, you know, sa mga nagtatanong ulit, yung is it painful? Siyempre, tolerable naman po yung pain. Siyempre, no pain, no gain.
Correct.
Pero it's very tolerable and downtime dito, Doc, mga less downtime, di ba?
Correct.
So you can still go back usually to your normal activities na ginagawa.
Yung mga meetings ni Ma'am Weng, marami siyang mga conferences.
Yeah. So, another, thank you, Doc. Thank you.
Baka pag 60 ka na, naging 50 ka.
Why not? If you can do it, di po ba? And many people are asking me, Doc, na, why do I do it, di ba?
Yes.
Why not, di ba, if you can do it po?
Right.
So, this is a self-care.
Correct.
So, for me, you know, it's very important. People invested in houses, in jewelries. So, why not invest para sa sarili mo?
There you go.
And I think this is good for you.
That's a very good message for all of us. Invest in yourself.
Yes.
Okay, there you go. So if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other videos. So the previous episodes of Ma'am Weng, please do watch them. Ano po ba ang inyong social media account that they can follow you?
Yes, they can follow me on my Facebook account po, Weng Laughlin. And of course, to our Mutya Pilipinas, Mutya ng Pilipinas Pampanga page po. So,
there you go. Thank you so much, Ma'am Weng. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.